lately on the internet, there's been a little bit of drama. Some people who were claiming to be long-term carnivores have now added back in some plants to their diet, and they're now making lots of videos saying how misled they were before and how this is the way. And I know you've been very active in some of the comments on these threads. What do you think's going on here, Dr. Chaffee? What's up with this? Is this just people who are click hungry and you hungry, or do you think they've discovered a new thing? What's going on?
Well, I don't know if I couldn't say that they've discovered a new thing, because basically the advice they're giving is the exact same dietary advice that we've been given for the last 50 years, which is get about 65% calories from carbs and have a bit of lean meat and some veggies and things like that. Keep your fat under 15-20%. I mean, I took a nutrition class in 1998, and that was exactly what I was told. So this is the same advice that we've been given for a long time, and that's exactly what has failed so many hundreds of millions of people up to now. That is the diet that I was raised on. That is the diet that gave my mom diabetes after 45 years. So I don't see that as a new concept. I don't think they've reinvented the wheel somehow. So it's going to be multifactorial. There's going to be a lot of different people that have different motivations. Some of them, I think this is directly related to their own bottom line and profiting from that. I think some people are genuinely concerned when they see these sorts of allegations that a ketogenic diet will elevate your cortisol, give you hypercortisolemia, can give you a sort of Cushingoid reaction, or that it will drop your thyroid. Some people, in fact, who have been carnivore for over a decade have had some issues, but said specifically, my cortisol is fine, my thyroid is fine, I don't know what's going on, but something's happening. And others using their story by saying, see, this is proof that long-term carnivore causes thyroid and cortisol issues, even though they've said explicitly it has not. That's what the long-term data shows. That's what the randomized controlled trials and meta-analyses of the long-term randomized controlled trials on ketogenic diet shows that you don't get hypercortisolemia. You get a transient bump, still within normal range. It's not hypercortisolism in the first few weeks, and then this normalizes and rationalizes. In fact, in medicine, in standard Western medicine, ketogenic diets are used to ameliorate the negative effects of Cushing's and hypercortisolism. So that when someone has a tumor and they're excreting too much cortisol, people are put on ketogenic diets in order to prevent the serious ramifications of that high cortisol before they're able to get surgery, or even continued after they get surgery as a definitive measure. So it's hard to say what the motivations are. I certainly know that in my patient population, I've worked with hundreds of people over the years, looked at their direct blood results and tracked them for 6-7 years now. I've never seen a single one do this. I'm very hands-on with my patients. So if there's an issue, we address it. And there are often ways to, there's often reasons why someone may be gaining weight or may have something. I've never seen it down to the thyroid or the cortisol. It's often because of food creep. People are adding in dairy, especially. That's a new trend that's going on. A lot of these carnivore recipes use a lot of dairy. Dairy will make you gain weight. And even if someone has been using dairy for a long term, they say, well, I've been using dairy for a long time and I haven't had a problem yet. Well, these things creep up. Like I said, the diet that they've gone to caused my mom to have diabetes in 45 years, not 4 weeks, right? So these things take a long time and they can build up. So there are a lot of different reasons, but when I work with people one-on-one, I've worked with thousands of people over the years now, there is always a reason. I mean, this is like you say, this is the proper human diet. This is what we're biologically designed to eat. And so I work on that idea that this should work. I mean, you're not going to find a lion. Well, everyone's individual snowflakes and everything like that. Like, well, okay, so are lions, but every single lion still needs meat, and they still do best on meat. And so if a lion is having a problem, I'm going to see, okay, well, meat shouldn't be the problem. So let's figure out what else is going on. And when I approach it the same way with people, we always find what's going on.
I think that's a great paradigm to operate under. I'll say this about the cortisol thing. I think a big part of what's going on is I think that it is very commonly undiagnosed for people to have hypercortisol syndromes. And as you know, there's several of those. And the average primary care doctor is terrible at diagnosing any adrenal condition whatsoever. And I think there's an underlying 1 to 3% of people who just have hypercortisolism, either from a tumor or from some adrenal dysfunction, that they don't know it. And even when that person starts carnivore, they're going to have great results. And you know as well as I do that doctors and patients in the carnivore keto sphere, we tend to be much more lab forward. We're going to check labs very often, and we're going to check a lot more labs. So I think what we're doing is we're uncovering this hidden hypercortisolism that probably 1 million people in America have, that their doctor just hasn't caught because they don't know what labs to check. And I don't think that these people who have added back carbs have discovered a new diet. I think basically they're saying, hey, you should follow the food pyramid.
Yeah.
Wait a minute. That's what got us here. And I think your story about your mom's exactly right. Yeah, you might feel better, but that doesn't mean that this is a healthy long-term option for you. And you know, I'm not 100% carnivore. Everybody needs to be carnivore for life. But I don't think adding back in rice, I don't think that's a magical ingredient that's going to fix a lot of underlying metabolic conditions. I think that's silly. Now, you brought up dairy, and I definitely want to jump into dairy because I have, through my years of studying nutrition, anthropology, archaeology, I have some very specific thoughts and beliefs on dairy. And I want to hear, what is your take on dairy? Let's just say for adults to start with. If somebody's 18 years of age or older, what part, if any, should dairy play in their diets?
Well, I mean, in a strict sense, but probably none from an optimal nutrition point of view. All mammals drink their mother's milk until they're sort of adolescents, and then or toddlers, and they get weaned onto their mother's diet, and they eat that for the rest of their life. So if we're saying sort of strict according to nature, that's what we would do. Now, dairy and milk have amazing nutrients that are extremely beneficial. They have a lot of very good things in there, great fats. The odd chain fatty acids seem to be cardioprotective. There's so many benefits, and vitamins, minerals, fat soluble vitamins and things like that. These are really beneficial. The problem is it comes with other factors. It has a lot of carbs. It's going to spike insulin. It has casomorphins that are going to tell your body to store energy, because that's the whole point, is you need to give these signals to babies so that they grow quickly, because babies are vulnerable. They get eaten. And so that have a very high infant mortality rate in the wild. And so you need to get these little babies bigger and into adulthood so they have a chance at survival. Now, if you are in a deficient state, and like you're in India and you're having a largely vegetarian diet, but you include cheese and ghee, like, please God, yes, keep that in your diet, because that's probably the only thing that's giving you some of these nutrients that you have to have. Weston A. Price found that he could reverse many developmental issues from lack of nutrients by giving people some raw dairy and things like that for those fat soluble vitamins that they weren't getting from other sources. So in that context, I think it can be very beneficial. It does have really good nutrients, but if you're already eating a lot of meat and with animal fat, you're already going to get all those nutrients. So there's nothing that you're missing by cutting out dairy. And I do see a downside to dairy as well from optimal health, and certainly from a perspective of trying to lose weight or even not wanting to gain weight.
Yep, I totally agree. And I think there's diet, as you know, can take on almost religious overtones.
Mm-hmm.
Your mom fed you a certain thing. It's part of your religion. It's part of your heritage, your culture. But I think that when you try to think about the human diet logically, there are two things, two different goals. One is not starving to death. And so I totally agree with you in certain countries in Asia and Africa. And, if you got access to dairy, eat the dairy, eat all the dairy, because it's much preferable to starving. And you will develop vitamin and mineral deficiencies that can cripple you or kill you, and you can get those from dairy. Now, and so if you're a starving child, a starving 18-year-old in India, and you start eating cheese and you gain weight and you gain muscle and you feel better, do you care if you have minimal chronic inflammation? No, you don't care at all about that, because you're not dead. You didn't starve to death. And so that I think that's, and then so then there's not starving. That's one goal of diet. But I think most of us in modern society, we're not in danger of that. What we're trying to do is optimize our health through diet and lifestyle. And I think I agree with you in that context. I don't think there's any, I think that it's never a net benefit to add dairy to your diets in any form, really. Now, do you agree with me that say whole milk, liquid milk versus fully fermented yogurt or kefir, do you think they are less inflammatory, less of a problem because of the bending of the protein?
Well, I haven't looked into it specifically from that context, but I mean, I suppose you could say that the fermentation process would sort of improve things slightly, it would reduce some of the carbohydrates and bring out some more nutrients. I haven't looked at it from an inflammatory point of view. I mean, it's going to still have a similar amount of casein, which can be inflammatory. And there's, of course, type 1 or type A1 and A2 casein. A2 being less inflammatory than A1, but still showing some inflammatory properties. So I don't know, but from an inflammation point of view, I would imagine it might be similar, except maybe a little bit reduced in the carbs. That might actually reduce some of the inflammation as well. But I haven't looked into it specifically, but from that perspective.
Yeah, I've been reading on that for a while, and it seems that when the microbes act, they eat up the lactose and they bend the protein molecules, the caseins and the whey. And it seems like that makes it less inflammatory. But I'm not saying it makes it uninflammatory. I think it makes it less inflammatory so that more people can enjoy some occasional dairy as a treat. But I really don't think dairy should serve a daily dietary need for adult humans now.